You are watching the Doc Talk Show.
Andrew,
Yes, please.
what you are doing is so incredible and it is so scalable and it is very effective because usually health is very expensive when you're really very sick and you have to come to a big hospital. You're going to require very expensive treatment. Sometimes that our government is not able to afford. I was looking up statistics and I discovered that the percentage of our national budget that is allocated to health is actually less than 10%, which is really appalling. Yet you have to be in the community. You as an individual, you have to be in the community. You're screening very many people. You're actually attending to the needs of very many individuals in the community where you're serving. And I'm curious to know, because honestly, I would want to do what you're doing in the community where my parents live currently, because they also don't have access to, you know, a hospital or a health center for where they're going to see a doctor. Yet the things that they may actually have, they don't potentially require a doctor. So I'm curious to know, how are you financing your community approach? Do you receive some primary health care funds that we see? How are you financing this?
Thank you very much, Doctor, for that question. First of all, as I said in the beginning, I'm trying to use what is locally available.
Yeah.
So this approach is actually not expensive, but yet it saves a lot of people.
Yeah.
Like at the time I bought blood pressure machines, I bought each at around 80,000. It was automatic, but I bought 5 of them for 5 parishes in one sub-county.
Yes.
And that sub-county has a population of over 10,000.
Those are lots of people.
All those people have been helped under a budget of around 400,000.
Yes.
So this whole thing doesn't need a lot of money. It just needs someone who is ready to go and someone who is passionate.
Yeah.
So first of all, I'm not looking at the finances because I'm there and I'm willing. So in most cases, I use what is there. In the beginning, I used my own equipment that I had, and people saw, they started supporting.
Yeah.
So some people who are interested in the work I do, who watch me on YouTube, because all the videos that I cover, I upload them when I'm teaching.
Yes.
Not just that people will see and support me, but I put them such that people who watch, who were not there, will also be able to learn.
Yes, so you have actually also received some
I'm trying
donations.
to cover everyone who is there and then those ones who are not there.
Yeah.
So because I'm willing, when I approach some people, like maybe a radio station also, usually they give me free airtime.
So you have also been on radio shows.
Radio stations. Actually, just after qualifying from school, I started that work of teaching and I was on the radio station. I had some, they give me about 5 days a week.
Wow.
Yeah, 3 days when I'm teaching in the local language and 2 days when I'm teaching in English.
That is so wonderful.
So it didn't cost any coin. Yeah. But because I was willing, there was a way.
Yeah.
So first, there is a desire that one, I'm depending on it so much. And then also I'm depending on the support that I receive from people who watch me on my YouTube channel. That is majorly the major source of income. And also, I use some of the money that I get from my workplace.
Yeah.
So when I work in my workplace and I get some money, maybe 800 per month or 1 million, I try to divide that money and I put some in the community, in the work that I'm doing.
Wow.
Because of the vision that I have.
Wow.
So that is how I've been getting the funds.
Yes.
But I've not yet gotten any PHC fund, like you said. In fact, of course, I'm not yet in government. I don't know what actually goes on there, but as I was practicing as a student, I remember people in the health facilities used to talk about PHC.
Yeah, very important.
When they are sharing or when someone took a big share. So that is how I used to hear many people talking about PHC funds.
Yeah.
But I've not yet seen it personally doing what I'm doing. But I
Yes.
would think that maybe primary health care funds, maybe they were meant to do the
What
work
you're
that
doing.
I'm doing
Yes.
currently.
Yes.
Yeah, that is what I think, but don't get me wrong. I'm not yet in government, so I don't know what happens there, but I've not yet received any PHC fund.
Wow.
But if they came, or if they gave me, then we could use it very well.
Thank you so much. It is so, I can't really explain it. The fact that you're actually taking part of your salary to do community work, to empower communities, to treat diseases, to prevent bad outcomes from illness. It is so commendable. Your approach is so significant because we know that over 41 million people die every year due to non-communicable diseases, things like hypertension, diabetes, things like that. And yet routine care, routine basic care and follow-up is sufficient to avert most of those deaths. It is important to know that 85% of those deaths from non-communicable diseases happen in low, middle, and income countries, and Uganda is part of those income countries. So if we need to avert these deaths from non-communicable diseases, but also the communicable diseases that we can treat in the community, we need to invest in your community approach to care, So it is important. And the fact that you're not receiving a lot of external support is quite a big challenge. What are some of the other challenges you're facing as you're trying to serve the community?
Yeah, okay. Yeah, in everything there are always challenges. We've had challenges like when I started, I wanted to cover a lot of people with those activities. And one, of course, financial limitations.
Yeah.
Yeah, like I started with one community, it was fully covered, bought some seedlings for them, but they were also distribute nutritious seedlings like oranges, mangoes, avocado for the people. As I teach them about a balanced diet, I also give them those seedlings such that they can plant and supplement the diet. But one of the challenges was, of course, I could not supply the numbers of people that I wanted. So finances were a problem, and of transport was also a problem to reach every other person. Sometimes I could go in the community and rain finds us there, and there was no transport back.
Yeah.
But thank God we got
a vehicle
that is helping us.
Yeah.
And then also I got some resistance from some health workers. Yeah, it is funny.
You're
It
taking
sounds
away
funny,
market.
but it is serious.
You're taking away
Some
market.
people thought that my approach was taking people away from them, that I was affecting their market because people will not go to the hospitals. But that should be a goal of every health worker, to see people living
thriving
a
and healthy
life. So I couldn't understand it when someone approached me and told me that you're giving people too much knowledge, so they will not come to the hospital.
Yes.
But in my teaching, I don't encourage people to do self-medication.
Yeah.
I actually teach them about the dangers of self-medication and the need to go to the health worker in case they feel or they find that they have a problem with themselves.
Yes.
But that is also one of the challenges. There are still some resistance from people who think that I'm doing a bad thing.
Yes. So I would like to know, are you a registered CBO? Are you an individual practicing as just a health worker? Are you an NGO? Are you registered? Like, what is your registration status, and have you found any resistance getting registered? Because usually when you want to register, for example, with Uganda Medical and Dental Practitioners Council, you need to have a physical location, So what is your status?
Yeah, so as I talk, we are registered as a community-based organization on a district level in Manafa.
Yeah.
But the district actually recommended for the upgrade to the NGO because of the work that they have seen. When I
Very
went to the
significant
district, I
work.
tried to explain, and most of them have seen what I do.
Yeah.
So actually, the whole district, the DSO, COW, and the DHO and others, they just recommended me. And as I talk, we are working with the Uganda NGO board to make sure that they upgrade it to the NGO status. So we are using the name Vuwanga Wet Health Foundation.
Yeah.
Wet Health. I think you get it. But the
Yes.
Vuwanga is a local term that means light.
Yes.
So in English, it can translate to Lightweight Health Foundation.
Wow. I am so excited to have had an opportunity to host an amazing health worker who is sold out to, you know, good health outcomes for the people in his community, but also for the nation currently, because now you're striving to get NGO status. We are going on a short break, and before we go on break, I want to thank the National Medical Stores and Campbell Men's Collection. Thank you so much for sponsoring the Doc Talk Show.
You are watching the Doc Talk Show.